Hello, my name is Nora Coyne, and I will be presenting the clinical tests from a patient. The patient is a 25-year-old Caucasian male, and he came in complaining of exhaustion. And exhaustion can cause a lot of things. It can make doing daily tasks difficult. It can prevent a person from doing things that they normally do, cause lack of focus, low motivation, anxiety, irritability, among other things. He is 6 feet tall, weighing 150 pounds. His blood pressure was 110/68, which is normal. And he's very active. He runs 5 miles every day. He follows a vegetarian diet and eats about 1,700 calories per day. Based on this information, it was hypothesized that the patient was suffering from dehydration, and the basis of this hypothesis is that the main symptom of dehydration is exhaustion, which we know we have that symptom. And dehydration occurs when the total body water is decreased because of low intake or high loss of water, and water loss can occur when exercising. We know this patient exercises every day, so he might be losing too much water and therefore be dehydrated. On to the clinical tests. The first one is the glucose determination, and glucose is a sugar that's found in the body that's used for energy, and these levels can get too high or too low, and the body will not function properly. This patient's glucose levels were examined using a blood glucose meter, Benedict's reagent test, and glucose strips, and they will help determine if this patient is suffering from hyperglycemia, which is having too much glucose in the blood, or hypoglycemia, which is having too little glucose in the blood, or diabetes, because diabetes will definitely show an abnormal glucose level. It's important to indicate that the normal glucose levels should be between 70 milligrams per deciliter and 100 milligrams per deciliter. So the blood glucose meters and the reagent strips or glucose strips both use the enzyme glucose oxidase on a test strip, which will react with the glucose present in the blood when oxygen is present, and the reaction creates gluconic acid and hydrogen peroxide. And this, the difference is the glucose meter uses blood and the strip uses urine. And then the meter also will use a small voltage and put it to the test strip, which will oxidize the hydrogen peroxide. And that current is measured, and the measurement will be converted into milligrams per deciliter, telling us the levels of the glucose in the blood, while the glucose strips also have another enzyme, horseradish peroxidase, which will oxidize in the presence of potassium iodide, and it will change the strip color in a range of colors, and that color indicates how much glucose is in the blood. And then the Benedict's reagent test also detects in the urine. And then the Benedict's reagent test also detects glucose in the urine. And it's when copper reacts with the aldehyde functional group in the glucose structure, and that will oxidize the functional group to carboxylic acid. And if glucose is present, the copper will turn to copper oxide, which will turn the solution brick red. When glucose isn't present, it will be blue. So as you can see at the top of the screen on the left-hand side, the blood glucose meter showed that the patient's glucose was 110 milligrams per deciliter. And then the glucose reagent strip was light green, indicating 100 milligrams per deciliter of glucose in the urine. And then the solution for the Benedict's reagent test was blue, indicating 100 milligrams per deciliter or less glucose in the urine. So all of these indicate that the glucose levels are normal. Next thing we looked at was the enzymes. So the two enzymes that were examined were creatine kinesis and lactate dehydrogenase, or CK and LD. Abnormal levels of CK and LD in the blood can indicate that there has been tissue damage in the body. So it will help determine if this person has rhabdomyolysis, or for short, rhabdo, which can cause heart and kidney damage. So to determine the concentration of these enzymes in the blood, a spectroscopy test is used, and the test looks at the interactions between matter and light. A spectrophotometer determines the amount and type of light that is transmitted or absorbed in the substance or by the substance. And the more absorbance measured, the more substance that is present in the blood. So this will happen over a period of time, a short time, like 15 minutes, and you'll have multiple measures of the enzyme in the blood. So that information is plotted on a graph using absorbance versus time, and the linear slope of this graph will help better indicate what the levels are in the blood. So normal levels of CK in adult males is 15 to 130 units per liter, and normal levels of LD in adult males is 100 to 225 units per liter. So here are the results of those tests. On the right side of the screen, you can see the CK graph, and that slope indicates that 244 units per liter are present in the blood, and that is abnormally high, so it's something to look into. On the left side of the screen, you will see the LD graph, and that slope shows that there's 126 units per liter present in the patient's blood, and that is normal. A urinary analysis was done, and the urinary system removes waste from the body, and it can really tell us what's going on in the body. So during this analysis, the pH, specific gravity of urine, ketones, and ion concentration in the urine were looked at, and the pH looks at how acidic or basic the urine is. So acidic urine can mean that the patient has acidosis, unregulated diabetes, is suffering from starvation. And the basic, or more commonly referred to as alkaline urine, could be an indicator of renal failure or urinary tract infection, among other things. So normal pH for urine is 5 to 6, and the pH scale is 1 to 14. Below 7 meaning it's acidic, and above 7 meaning it's basic or alkaline. And then the specific gravity compares the density of urine to the density of water to determine how the kidneys are functioning and if the kidneys are able or not able to dilute the urine. So the greater the specific gravity of urine, the more particles that are found in the urine. And a normal specific gravity for an adult is 1.005 to 1.030. Then the ketone test uses dinitrophenohydrazine in 95% ethanol added to urine sample. And when it's heated, if a precipitant forms in the reaction, then it's a positive indicator for ketones. And ketones might indicate diabetes or starvation. And then ions in the urine can tell us that the body is trying to get rid of these because they have too much. And there are multiple ions that can be found in urine, and they all mean different things. But for example, potassium ions in the urine can indicate muscle damage and kidney problems. And then finally, the Ullrich reagent test checks for urobilinogen, and when these levels are high, it can indicate liver problems. And so how this test works is the Ullrich reagent is added to a sample of urine, and you watch for a color change or a reaction. So if the solution turns pink, there was a reaction and there are high levels, but if it does not turn pink, then the levels are okay. So here are the results for that. We can see at the top that specific gravity and pH were high. Then the ketone and bilirubin were both fine. They were normal. And we also see that on the left-hand side of the screen with the test tubes, there is no precipitant, so there's no ketones present. And then the final image is the Ullrich's reagent test, and you can see that the solution is not pink, so that is also normal. And not pictured was the electrolyte or ion panel, and that did show increased levels of potassium ion. So conclusion of all these results, The glucose determination did not show any abnormals of glucose, so that kind of rules out hyperglycemia, hypoglycemia, and diabetes. The enzyme kinetics test did show that the patient has high levels of CK in the blood, so that may indicate that there's tissue damage, and tissue damage could also indicate that the patient has rhabdo. The urine analysis showed that the urine contained high levels of potassium ion, a high specific gravity, and high pH level. And all these things can indicate renal damage or kidney damage. And high potassium can also indicate rhabdo. So the final diagnosis is rhabdomyolysis or rhabdo. And it is when there's a breakdown in the muscle from damage and it releases muscle cell contents like enzymes and ions into the bloodstream. This can cause kidney damage, nausea, vomiting, permanent disability, and even death in severe cases. And these symptoms include feeling weak or tired, which is what the patient came in complaining of, muscle cramps, aches, dark urine, but it's also possible that there may be no signs or no symptoms. It can be caused by heat exposure, physical exertion, or trauma like crush injury or fall. The patient did explain that he exercises every day, so it is plausible that he has a muscle injury due to his running and exercising. The enzyme test showed high levels of CK in the blood, which is the only accurate test for rhabdo. So if the test indicates that the levels of CK are high, that means that the person could have rhabdo. Other clinical tests showed a high pH, which was 8, a high specific gravity of 1.040, and an increased level of potassium ions in the urine, which all indicate that the person could have kidney damage, which is a common problem associated with rhabdo. And finally, the treatment plan. So the treatment plan for rhabdo depends on the severity of the illness. If it's caught early, the treatment is drinking lots of fluids, staying out of the sun, and resting. But for more moderate cases, which we're seeing here, because we are seeing some kidney damage due to the pH in the urine and the presence of potassium ion, that would require hospitalization where IV fluids can be administered in order to flush out enzymes and the ions in the body. And this will also prevent further kidney damage from happening. So the goal here would be for the patient to be producing 200 milliliters per hour of urine so that we can ensure that these enzymes and electrolytes are being flushed out. And the fluid should continue until the pH is back to normal, which would be 6, and the levels of potassium ions in the urine are decreased.